Hi, my name is Madrose and my matric number is 06DKA19F2059.
Hi, I'm Adiena Airien and my matrix number is 06DKA19F2034. We are in class DKA1C and from Polytechnic Port Dickson. Don't forget to like,
Share
and subscribe
our video YouTube channel.
Assalamualaikum and a very good morning. I am Nur Adiena Airien and currently is accompanied by my partner Nurul Farhanai.
Hi.
Today we are here to create awareness regarding a disease that can be a trait in our
We
life.
are well informed that on 8 March is the day where we celebrate Women's Day. In this video, we will discuss about a disease that can be a nightmare for women. The disease is
Breast cancer.
Our presentation objectives are organized into the 5W's of breast cancer that you should remember. First, who developed breast cancer? Second, when does breast cancer show up? Third, why does breast cancer appear in certain individuals more than others? Fourth, where does breast cancer develop? Fifth, what do breast cancer patients present with? And finally, we will discuss how we manage breast cancer patients.
First, let's talk about who develops breast cancer. Cancer is the most common cancer among females. In North America, with 109 women expected to develop breast cancer over their lifetime. While the majority of breast cancer patients are female, breast cancer can also occur in males. How does breast cancer appear? The highest rate of breast cancer diagnosis is between the age of 50 to 70.
Why are some people at greater risk? There are many risk factors identified for breast cancer. One main risk factor relates to the level of exposure to estrogen over one's lifetime. These factors include early menarche, late menopause, later age of pregnancy, or no pregnancy, and hormone replacement therapy. They are all associated with increased estrogen exposure and hence an increased risk of breast cancer. Some people may also have a hereditary syndrome that puts them at much greater than normal risk for breast cancer, such as a mutation in one of the BRCA1.
Of mammary glands, surrounded by connective tissue and fat. Exteriorly, the nipple is surrounded by a dark pigmented region known as the areola. The mammary glands consist of two portions, secretory lobules and ducts. The majority of invasive breast cancers are adenocarcinomas, derived from epithelial tissue in these lobules or ducts. High-grade dysplasia in the lobules is known as lobular carcinoma in situ. And similarly, in the ducts, it is called ductal carcinoma in situ. Similarly, invasive carcinomas that develop in the lobules are termed lobular carcinomas. Also, invasive carcinomas that develop within the ducts are termed ductal carcinomas. Mammograms aim to detect cancers at early stages, either before or at the in situ stage, by measuring tissue density through compression and X-ray radiography. Detection at this pre-malignant stage is important, as carcinomas in situ are not invasive and can be curatively treated.
What do breast cancer patients present with? Breast cancer can be asymptomatic at diagnosis and is therefore detected mammographically in many patients. However, some breast cancer will present symptomatically with a lump or thickening in the breast in more advanced cases patients present with nodal disease or metastasis.
Finally, how are breast cancer patients diagnosed and managed? If a patient presents with a mass of mammographically detect a vision aside from our history and physical, you should try to obtain a tissue diagnosis. Tissue diagnoses are often image-guided and can use as an ultrasound or mammogram in the case of stereotactic biopsy. Often, cases her nodal spread with a sentinel lymph node biopsy, where samples are taken from the first few lymph nodes into which the tumor drains during a partial mastectomy or other operation. Further imaging such as bone scans, chest X-ray, or CT scans may be done if metastasis are suspected in other organs. It is time for us to end our talk. In conclusion, there are many diseases that we have to be aware about. But to support our talk for today, breast cancer is definitely a trait for women.
If there are anybody in our life that diagnosed and suffering from breast cancer, we as an individual must give our moral support to them. Not only it can give them strength for them to survive, but also be a reminder for us to always take care of our health. So with this statement, we are here to say goodbye. Bye!
Thank you!